All right, so good afternoon, everybody. I'd like to welcome everybody to the Maricopa County News Conference on this April 20th from the Unified Command. My name is Moseley. I'm the Communications Director for Maricopa County, and I'm also the lead PIO for the Joint Information Center that is here to support Unified Command. I'd like to thank our friends in the media, news reporters who are joining us here today, and I always have a lot of good questions. We appreciate you. Also, people joining us live via YouTube, thanks for being here. We hope you find the information useful today, as well as those on Facebook. Thank you for being here. Today's topic is about working together in times of crisis, because there are a lot of people behind the scenes that you have never heard about, nor would you hear about them until we are in a situation like this. But they train together, they work together with organizations like our emergency management group and public health for this type of situation, and then they help in our response. So these groups prepare with us all the time. They run through scenarios with us as well. Some of those organizations are part of what's called the Maricopa County Community Organizations Active in Disaster, or MC-COAD. So there's also, some might be familiar with Volunteer Organizations Active in Disaster, or a VOAD. So this is pretty common in the emergency management lingo. Obviously, that's new to a lot of people. So we're here today to talk a little bit more about that. And Robert Rowley, our Director of Emergency Management, will give you some insight as to how that was created not so long ago, and we are certainly thankful that it's in place today. Also, you're going to hear from Justin Chase. He is the President and CEO of Crisis Response Network. He is also a trained social worker. His organization is running the 211 call line that you might be familiar with, also the crisis hotline that is available to all residents at this time and during this time of need. We also have Dr. Rebecca Sunenshine from Maricopa County Public Health. She will be available for questions today from our friends in the media. So, members of the media, if you've been a part of our news conferences so far, you understand how this works. You'll be called upon by our moderator after you virtually raised your hand, and then the moderator will open up your microphone. If you raise your hand, please unmute your microphone at that time, and that way it's available for you to answer or ask your question whenever your time comes. So please note, try to only ask one question. We've always been able to get back around to second and even third questions during these news conferences, so we'll certainly make that available to you today. If you're having difficulty raising your hand in the webinar or unmuting your microphone and the software seems to be a little glitchy, that happens from time to time. If you can't resolve it, don't keep clicking on it. It will block up the software. It's recommended that you go ahead and log out and then log back in to the webinar. So with all that information, I will introduce you now to our Director of Emergency Management here in Maricopa County, Robert Rowley.
Good afternoon. My name is Robert Rowley, R-O-B-E-R-T-R-O-W-L-E-Y, and I am the Director for the Maricopa County Department of Emergency Management. Last year, the Maricopa County Department of Emergency Management recognized the need to organize a group called Community Organizations Active in Disaster, or COAD. A COAD is exactly what the name implies and includes any organization that could have a role in a disaster response. The organizations come from the public, private, nonprofit, and faith-based organization sectors. The Maricopa County COAD was officially established just 3 months ago and now comprises 30 different organizations. The COVID-19 response is the first time the COAD has been activated for an emergency and is fully integrated into the Maricopa County Unified Command. Currently, COAD organizations are providing support for several missions involving people experiencing homelessness. For example, in our East Valley Shelter for At-Risk Individuals, Southern Baptist Disaster Relief is providing meals for 3 weeks, and the Salvation Army is prepared to provide meals after that. The Phoenix Tool Bank is supplying outdoor games and picnic tables for outdoor seating, and the Maricopa County Medical Reserve Corps is providing transportation for the tables to the location. Presbyterian Disaster Assistance and Hands On Phoenix are providing hygiene kits and personal care items. Valley of the Sun United Way has supplied laundry bags and Goodwill is prepared to make clothing and activity items available if needed. At our downtown Phoenix medical isolation and quarantine overflow site, the Salvation Army will provide hygiene kits, and the Arizona Humane Society is standing by to provide care for pets if needed. In addition to all of that, Maricopa County Medical Reserve Corps volunteers are staffing a call center which provides information to the public seeking COVID-19 information, as well as making hand sanitizer and helping distribute personal protective equipment. The Arizona State University Center for Emergency Management and Homeland Security is assisting with data collection, geographic information system tracking and displays, and volunteer help for website creation and workflow management. The Arizona Humane Society is providing care for pets of people hospitalized with COVID-19. The Crisis Response Network is managing information flow through 211 Arizona. The Phoenix Tool Bank is lending tools and equipment to organizations responding to COVID-19, and also provided 150 chairs to Justice Center, which serves homeless seniors and will help move activities outside. The Consulate General of Mexico is assisting with outreach to Spanish-speaking communities. Local food banks continue to provide food to those in need. And finally, the ASU Center for Emergency Management and Homeland Security, Arizona Humane Society, Phoenix Tool Bank, and Crisis Response Network are all providing liaison staffing to the Maricopa County Unified Command. As you can see from this list, the Maricopa County COAD is an integral part of our Unified Command. The services member organizations provide take considerable stress off of our limited government resources while simultaneously increasing the level of support we can provide our community. This is all part of leveraging resources and capabilities of the whole community, where it is recognized that everyone, from the federal government to the private citizen, have a role in responding to a major emergency. Thank you.
All right, thank you so much, Robert. I now want to welcome Justin Chase. He's the president and CEO of Crisis Response Network, and we certainly thank him for being with us today.
Good afternoon. My name is Justin Chase, Justinchase, and appreciate the opportunity to highlight some of the resources and services the Crisis Response Network offers here in the community. So we've been able to provide during this time response in addition to the crisis hotline and the peer-operated warm line, being able to operate a COVID-19 response line through 211 and the ongoing support of information and referral services that 211 offers. On March 22nd, the 211 COVID line was activated at the request of Governor Ducey for us to serve statewide, and we've been honored to be asked to partner in this way to support the community. Individuals can contact the 211 COVID line for any questions and information needed related to the virus. The bilingual COVID line is accessible 24/7, but we have it staffed from 8 a.m. to 8 p.m. 7 days a week. Trained live answer specialists listen carefully to callers' needs and questions and their concerns and connects them with community resources as they need them. To date, the line has received over 25,000 calls and been able to assist more than 6,000 individuals through the 211 live answer capability. Trends that we're identifying through the call center are related to questions related to COVID-19, symptoms, how it's contracted and spread, who are vulnerable populations, and latest statistics regarding positive rates. Our second highest need that we're identifying is financial assistance. Individuals are looking for resources related to rent payments, homelessness needs, utility assistance, and eviction prevention resources. In addition to that, we're also finding a high need for food assistance for individuals and families that are in challenging times financially. In addition, the 211 is partnered with Maricopa County to offer support for employers who may have questions or concerns regarding their operation during the times of the COVID-19. The crisis hotline continues to operate 24/7. available to anybody in the community that's experiencing a challenging time or having difficulty coping with the latest situations. Trained crisis specialists provide support and information telephonically, and if necessary, can dispatch a mobile crisis team or coordinate with a community partner to engage the individual face-to-face. Crisis line data to date, for March, we wound up with 22,000 calls into the crisis hotline for Maricopa County. That is an increase of 10% from the prior month. We are seeing a drop in children's related calls significantly, primarily tied to the closure of schools at this time. We're seeing an increase in adult calls related to anxiety and medical concerns. And we are currently, as expected, seeing a decrease at the time for depression and suicidal ideation related calls. Mobile crisis team dispatches are down by 10%, and that is expected at this point because of the fact that the schools are closed at this time. So our children's related calls are down, but we're seeing an overall increase in 9% for adults, as well as a 19% increase from requests from law enforcement and first responders in the community. It's natural for folks to feel anxious and unsure during times like this, and everybody responds differently to heightened levels of stress. The CDC has identified individuals who are more likely to experience stress and challenges during this time: older individuals and individuals with chronic conditions, children and teens, people who are helping to respond to the COVID-19, including healthcare workers and first responders, and people who have existing mental health challenges and potentially challenges with substances. To support yourself and others during these difficult times, it's recommended to take breaks from watching, reading, and listening to news, including social media. Hearing about the pandemic on a repeated basis can be unsettling. Taking care of your body, taking deep breaths, stretch, meditation, and mindfulness, trying to eat healthy and well-balanced meals, exercising regularly, getting plenty of sleep, and avoiding alcohol and drugs. It's important to make time to unwind, try to do some other activity that you typically enjoy, and connecting with others. We're physically isolating at this point, but we want to maintain social connectivity with others. So talking with people you know and trust, and talk about your concerns and how you're feeling. If you're concerned about a loved one, please reach out. Please engage with them. Ask them how they're doing. It's important during times like this that we connect even more. Please know that the crisis hotline is available 24/7 at 602-222-9444. That's 602-222-9444. In addition, the 211 system is operational 24/7 at 211, and you can achieve this through your telephone system. I'd like to thank you for the opportunity this afternoon, and I appreciate it.
Thank you so much, Justin, for joining us today. Justin Chase from the Crisis Response Network joining us today. So at this point, we'll open it up to questions from members of the news media who have joined us via the webinar. And Chad, do we have anybody who has their hand up?
We have a couple of questions. Our first is from Rachel Langay. Rachel, your microphone is live.
Hi, Rachel Langay with the Arizona Republic. I'm wondering, from a public health perspective, what do you guys see as the steps that are needed before the economy can reopen?
All right, thank you, Rachel, for that question. I'll invite Dr. Sunenshine to come up here and address that.
Good afternoon. We're currently reviewing the President's recommendations and working closely with the Arizona Department of Health Services and our other local health departments to determine when it will be safe to start opening up businesses and other operations. Thank you.
All right, thank you, Dr. Sunenshine. Thank you, Rachel, for that question. Do we have another question?
We have one more question from Leon Gonzalez. Leon, your microphone is live.
Hi, thank you for your time. I think I have a glitch, as you mentioned, because my hand now looks here, you know, in red and on raised. but I'm gonna take advantage. Thank you for your time. And I would like to know about depression, anxiety, and also we were struggling as a state and as a country with overdoses in recent months. And I would like to know if there's also an increase in this area.
So an increase in overdoses, anxiety, depression. So an increase in overdoses specifically, Leon?
Correct.
Okay. I'm not sure if we have that kind of data, but I think Justin might be able to cover this more broadly, at least.
Yes, regards to the question regarding substance use rates, increased use in drugs that result in overdose. I don't currently have statistics on the any trends related to overdose increase, but we are seeing with an increase in anxiety and a continuation of needs for depression and the calls that are coming in related to substances, we are seeing an increase at this point in those related calls for substance use.
So, Leon, I know that doesn't exactly answer your question whether or not we're having higher levels of. We do know if it's the data that's coming in and the number of calls we're taking certainly would seem to lead us to believe that there's a higher level of anxiety. That's certainly natural in the situation we're all in right now with the pandemic. But we just don't have that data on whether or not there's a higher level of overdoses in the community right now. So, Chad, do we have any other questions today?
Yes, Rachel would like to ask a follow-up. Rachel, your microphone is live.
Hi, sorry, I had a follow-up
Sure.
to the question for Dr. Sunenshine here. Can you provide any details? For instance, do we need more testing? Do we need better contact tracing? Things like that before we can reopen businesses?
All right, thank you, Rachel, for that question. Dr. Sunenshine's addressed this before, and she'll come up and answer this once again.
What's in the president's recommendations and what all of the experts are looking at is what conditions will put us in the best position to be able to begin to relax social distancing and open up businesses and operations safely. And we know that among the things that are important is having enough testing available so that we can have accurate surveillance. It's also important to be able to have enough healthcare capacity so that if we see a surge in the number of patients who need care, require hospitalization or intensive care, that we're able to meet those needs. And it's also important that we have the ability to be able to monitor things and do our contact investigations to the best of our ability. We have been able to maintain case investigations throughout the outbreak and contact investigations. However, we are not currently able to do them at the full capacity, and that is something that we are trying to maximize to make sure that we are implementing every public health related surveillance activity that we possibly can so that if we do see changes after we relax things, we'll know about it right away and we can make the appropriate decisions working together with the health department and with the governor. Thank you.
Thank you, Dr. Sunenshine. Thank you, Rachel, for that question. Chad, do we have somebody else?
Juan Juarez has a question. Juan, your microphone is self-muted. If you can unmute it, we'll be able to get to you. Okay, Juan, your microphone is live.
Okay, great, thank you. So I guess this is for the doctor. We've seen a lot of different groups protesting throughout the country recently, demanding for the reopening. We supposedly have a group here locally that's doing that as well. Are they putting the rest of the population at risk? And if so, what is the county or the state trying to do to address this?
Juan, I certainly respect the question and appreciate the question, but that's not a question for public health right now. Are they putting people at risk? I think it depends on how they're protesting, what they're doing, and are they putting their own safety at risk if there's disease within that particular group. From what I saw yesterday, people were driving around the Capitol and that sort of thing. They're certainly in their own vehicles and not gathering en masse, but I understand the intention of the protests is the same. So, you know, that's not our call to try to stifle a public assembly or anything like that, and we certainly wouldn't make that call. So that's really not a question we can answer here any more than I already answered it. So I appreciate the question, though. Chad, do we have anybody else on the line?
That was the last question.
Okay. If we have no other questions from members of the media for our subject matter experts here today, thank you so much for joining us on the webinar, and we will let you know of our next availability. Thanks again.